Well, I've been out of dental school, graduated in 1988 from The Ohio State University. And for the first probably 15 years or so, my practice did general dentistry, fillings, crowns, just general tooth dentistry, if you will. Started having children, and my first child had airway issues from a very early age, which started me looking for answers. Then I also started noticing some dental consequences of those airway issues, and it kind of got me into what's called functional orthodontics, where we start to look for causes, and it kind of brought together the whole idea of airways and jaw joints and teeth and how they relate, to where I feel like now I'm able to practice what I call whole body dentistry. First and foremost, we want people to know that we care. We care about them as people. We are looking at their whole person, not just 4 white teeth or a jaw joint or even an airway. Patients come in with all kinds of baggage, and many times they have not been heard by other practitioners. They've been dismissed as being crazy or whatever. Several years ago, I had a patient who came into my office. She was a competitive dancer and danced with both of my daughters, who were also competitive dancers. She, at the time, was a senior in high school. She couldn't go to school because she was so dizzy that she couldn't walk across the room without vomiting. She came into my office because she had heard, through probably my daughters and a few of their friends whom I had treated, that there are other things that can be related to improper jaw position. So she came into my office, and sure enough, her jaw was not in a very good position. We actually put her in a splint, an orthotic that put her jaw in a better position, allowed the nerves and blood vessels in the back of the joint to function properly. And within 24 hours of putting her appliance in, she was dancing a modern dance solo at a competition. So that's probably one of my favorite stories, just because, first of all, it was a very quick turnaround, which doesn't always happen, but to take somebody with a symptom that they would never think of even asking their dentist about, it's very rewarding. Taking somebody from not being able to breathe through their nose and feeling crummy all the time to being able to breathe, feeling better during the day, whether it's a child that we get their tonsils and adenoids out, or it's an adult where we use a dental device to treat or manage their obstructive sleep apnea. Getting people to feel better in their life is probably the most rewarding. You can find us on the web at drdawne.com. You may reach us by phone at 614-781-2322. We also have a Facebook page, Dr. Dawne Slabach, and my personal Facebook page, which also has a lot of valuable information, Dawne Slabach DDS.